If the Department of Government Efficiency called me, we could fix healthcare. Welcome to Jay's Corner. It is Sunday, February 23rd, 10 a.m. Eastern. My name's Jay O. I'm a certified financial planner. I'm the author of Maximize Your Medicare. You can buy it anywhere a book can be found. It's also in the largest library systems throughout the country. Lastly, I'm an education fellow at the Alliance for Lifetime Income, a nonprofit which is used to educate the function of annuities to professionals and the general public. So here's something I want to make a first point here, which is that you should subscribe to the Substack, jo.substack.com. The URL is below my image there in the text underneath the video. This is jo.com, and I just want to say a couple of things here about my work and mainly what I think about my work, which is I'm not here to change your mind. I'm not here to change your philosophy. I'm not here to change your politics. I can tell those people who come with a particular bias and I see them because they unsubscribe to the newsletter. In other words, they're trying to read into something that is simply not there. I can agree, I can disagree. I'm not spending energy trying to change your mind. I'm trying to provide information and guidance about the world that we have, not the world that we hope for. And that world that we hope for will differ from person to person, from location to location. I promise you, your next door neighbor has a different idea. I'm not here for any of that. That if you are reading my messages and my information as that's on you. I'm trying to help you understand the world that we have at the way that it worked today. Some of the stuff is just, to be candid with you, befuddling to me. Crazy. I understand that there's a lot of misinformation and mistrust about financial people in general, the financial guidance industries, if you will. For us here, fiduciary responsibility, always duties first, plan first, solutions follow. These are the cornerstones. These are the starting points. These are not up for debate. I simply don't understand it because for me, these are given. These are given. Doesn't matter what your politics or philosophy is. I'm very sure that our roster has plenty of people where I fundamentally disagree. That all said, jo.substack.com, there is a free and paid version. The free is yours. The paid version, you get access to all the archives. You can make comments. There are special member-only information and videos, special extra insight for those people who need to know more. And that's pretty much everyone. I already understand this. But the reality is that since I'm not here as giving you a philosophical or political message, there are financial responsibilities that I have. There are regulatory responsibilities that I have that I cannot cross. Due to the sensitive nature, that's the reason for the paywall. Okay. That all said, we're on to the show here. You can see a pretty long agenda, but we're going to be able to get through it quickly. So DOGE has arrived. I think that is not a shock to anyone, and people are becoming unemployed. Again, you already know the news. Federal employees, temporary federal employees, voluntary layoff, terminations, whatever you want to call it, right? It is just one simple example of what I'm calling white collar recession. You can look that up on Google by yourself later. This is true. I think that the fact is that you will see many companies laying off people of who you would have thought would have had a stable career. Some of that is AI. Some of that is global competition. I'm not here to settle the economics of how this is occurring. I don't think my own personal opinion is that I don't think this is going away. The world is changing fast. Our global competitors are capable, right? In other words, the fundamental structure of companies is going to change. We don't need these middle layers of a lot of professions, to be candid with you, that we may have thought were gold, perfectly secure. Software engineer, X-ray technician, AI itself has obviated many of these positions. I want to first go to the people, if that is you, for whatever reason that you've lost your employment. What you need to address immediately, I can't stress this enough, is what benefits do you retain and what is their cost? For most people, that first means health insurance, right? Because your 401k, your pension benefits, they're going to be set in stone when your employment ends, but those are yours. Federal law will protect you. I'm pretty sure about that. For example, ERISA law doesn't allow someone to take away your pension if you had defined benefit pension. You may not get increases, you may not get contributions, but there will be a stated fund number balance. The same thing for 401k. The same thing for your TSP if you're a federal employee. Right? I'm not overly concerned with the balance. We do have planning matters to take. The things that can move, however, is health insurance. And for that, that means that if you work at an employer that is 20 employees or more, then you have access to COBRA. COBRA doesn't necessarily mean good or bad. It is just simply a right. We're going to get to the interaction, to the other topics, as we go here today. Your timeline here is important. You need to understand how it works, and there are very specific dates. Right? The employer has to notify you in writing. From the time that you get that notification, you have 60 days. Right? So now the employer has some rule. They've got to send you a notification within X days. And then when you receive it from there, the time clock is started. Some of the letters actually tell you when that time clock is starting. They're going to tell you when your coverage when your timeline to accept COBRA or not ends. That does not mean that you snap and quickly accept COBRA. I don't suggest this to anyone. You first learn what your possible options are. When I said down here at the bottom, schedule your free consult, a lot of our time has been used for those people who are facing the unsettling situation of becoming unemployed. It's a very reasonable first set of questions to ask. Where do you stand? How much will it cost? It is a fact that today, as it currently stands, we're going to get to DOGE and what is happening on the ACA and Medicaid as well as Medicare very shortly, which is that yes, can you get the Affordable Care Act, otherwise known as Obamacare, at $0? Yes, that is entirely possible. Link is in the text below the video, and here's just a simple example of someone living in Ann Arbor, a married couple, with one child, right? And I'll show it to you here, right? A 50-year-old male, 50-year-old female, 24-year-old male, making $100,000. Now, this is your taxable income in 2025. Okay? This is a very subtle number. A lot of our work has to do with making sure that we get the right estimate here. And the reason for that is because that affects your premium. And you can see it right here in this red, which is the full sticker price is $11.45. But once you get the tax credit, $533, $600 a month difference is a lot to anyone, particularly when you have this unsettling situation of not knowing your employment. whether or not you've accepted the voluntary, whether or not you take the early buyout, whether or not your position has been terminated, doesn't matter. The same exercise to everyone. This is the first stop. Under COBRA, you've got something that not enough people understand or use, which is you have a very valuable look back option under COBRA. Very valuable. And when I say it's valuable, what ends up happening is since you have 60 days to decide, I suggest to people to wait because of this look back option that people do not understand. For example, here it is right here. If you got sick on the 55th day, you can, in other words, when you accept COBRA, the start date goes all the way back to when your employment ended and the coverage under your active employment ended. So if you break your leg on the 55th day, you can have your insurance start when your employment ended and you're fine. You're covered under COBRA. Let's say you don't get sick. You're Mr. or Miss Perfect. In theory, you can wait all the way to the 59th day and then buy COBRA starting on the 60th day and you'll be the first of the next month. You're fine. Know that the first payment, it is complicated. I never think that you should do things for yourself, right? Because these details, if you miss a detail, I can't help you after you miss the detail. I can help you tons before we get there. Once these dates pass, my hands are tied. Okay, I just simply can't. No matter what I do, I can't help you if you delay. This type of information so subtle here, and here's just a simple example, which is the reason I put it here on your screen, which is you can see there in blue, the first payment must be made prior to the day that your Affordable Care Act plan will begin. Must. What's not here is you absolutely need to use either your healthcare.gov portal or your state-specific portal in order to capture this lower premium here. You cannot just go and just sign up without going through the application process for this credit, which is this difference between 1145 and 533. So in other words, there are these little steps, details, important steps and details in order to figure this out. Now, the reality is that this is my note for the Alliance for Life. I very frequently point this paper out, which is this here is a copy of a research note that I wrote for the Retirement Income Institute, part of the Alliance for Lifetime Income, the nonprofit that I told you that I'm education fellow for. It tells you how and why these tax credits work. So, if we go back here, what you get is that these are important things because the result of DOGE has had these ripple effects that affect people. If you go on social media, you'll find a YouTube short. You'll find a TikTok video. The farm subsidy that I thought existed is gone, for example. Right? It's just simple examples that are getting the headlines today. Nevertheless, the fact is that this can be, everything that I've stated so far, can be stated for any person who has lost their health insurance as a result of unemployment for employers where there are at least 20 full-time employees. Okay. Let's talk about the ACA and Medicaid. You don't need a crystal ball. The headlines will start flying and have already started flying very quickly here. That Department of DOGE will be announcing findings. Hot takes will start flying around. I do think that certain, for example, that the underwriting for pre-existing conditions is likely to be safe. I think that that is, not a very complicated prediction to make, right? So that once you can apply, they're not going to ask you whether or not you're a diabetic. I don't see that. That said, I think that the finding the guidance privately is going to be notably more difficult. Navigator funding, which are people who are there for information. They are not licensed brokers, but they are volunteers. The funding has been cut from 100 million to 10 million, a cut by 90%. For me, the question is going to be this. The question will be Medicaid expansion, otherwise the advanced premium tax credit. So when I said this, the question is going to be the structure and whether or not you are going to be able to qualify for this. This is directly related to your taxable income in that year. Directly related to taxable income. This is the key thing. This is why I spend this time with people in trying to figure out what their taxable income is so that we can get to this efficient answer. I'm trying to help people drive this down so that what is already an unsettling situation is less so. Very simple. That said, the innards, the calculation, how you qualify, what the price is, how to choose the plan, those are complicated steps. This explains how the premium tax credit actually works. Okay, now, the issue is whether or not that becomes under fire. Because the reality is a lot more people have qualified for this advanced premium tax credit. A lot more. All the way up to 400% of the federal poverty level. So federal poverty level is a, unfortunate term. And I can't spell it. That it depends on your household income and your taxable income. Your household size and your taxable income. So you can see the implication, and I'm going to stop the financial. I'm not going to get too far into financial planning, actually until down here, which is basically that the lower that your taxable income is, then the lower your health insurance premium will be. And yet, I still understand that, you need cash in order to pay for groceries. And the eggs that you see everywhere on your YouTube shorts and TikTok. Right, so as a result, it's this balance now, and you can see there are steps involved. It's complicated. I try to make things simple. The reality is Occam's razor doesn't work here because the underlying situation is complicated. I understand, and then you can ask me 1,000 questions, right, until it's clear to you. From there, it's to the consumer, of course. Right, Mr. Perfect chooses a different plan than Mr. Sick-a-Lot. Reasonably so. Last point about here is that COBRA is going to be expensive, but there are many situations where COBRA is still the most efficient. I can't decide that for you without knowing lots of extra facts about you. So you can see here that the point is when it comes back to, right, this is a financial literacy is probably too convoluted, a financial awareness channel, if you will, right, which is that I'm trying to help people draw this balance between, okay, here's what you're able to do, here's how much it costs, well, okay, how much will it cost, and how can I make this fit a person's budget, irrespective of their household net worth. Okay, so now here are the good news, right, is the flexibility is still ultimately in the buyer's favor. Right? Under health insurance, it is so highly regulated that it's still in the buyer's favor. So there is good news here. Now, let me just say also, this is going to become under fire, and the political machinations that are going on are real. I don't think that is, avoidable. This question here is on the block, and the reason is the Inflation Reduction Act increased the number of people who could get the advanced premium tax credit. If I take a look at X, this is Larry Levitt. By all means, I don't compliment people wholeheartedly easily. I would compliment this person. Okay, this person is the executive vice president for health policy at Kaiser Family Foundation. He probably presents facts in a non-political, non-philosophical way as well as anyone on social media. He's the exceptionally qualified on top, right? We can have exceptionally qualified and hugely biased. This is exceptionally qualified and just giving it to you straight for the most part. And you can see it here, which is kind of reprinting this question from this article from New Republic, which is, and I would agree with this, which is that, and if I looked at this article, here's the key, which is in these swing districts, a whopping 80% favor extending the Affordable Care Act subsidies for health insurance that Democrats expanded in 20 and will expire this year. This is the question here. I would absolutely think that this could possibly be on the block. The question is whether or not the Department of Government Efficiency versus elected officials. Whether or not these come into conflict is the reason that I'm sitting here going about the question. What is already in the headlines is Medicaid. This block here. And you can see the conundrum here, right, which is that this here. GOP playing with fire as they weigh cuts to Medicaid, including West Virginia. And it's just a simple example of a singular state. You may have heard a month ago or so that healthcare providers couldn't access Medicaid payment systems. That continues to be true today, depending on the location. I know this anecdotally because of one of my business contacts reported it to me. That they are it's a healthcare provider, a large recipient of Medicaid funding from their particular state. They're not able to get that connectivity. The question is if you cut the Medicaid system, a lot of people in my state, and we are voted overwhelmingly for President Trump. And again, you could put President X, it doesn't matter, right? If you cut Medicaid, then somebody's going to be hurt. This is, again, back to, politics unwelcome. It is just so happening that we are talking about this here today because of the fact that large cuts to Medicaid are being proposed. Some of this makes total sense, logical sense. And the reason I say that is that states are picking off the federal government. And it's going to be a little bit complicated here, so you'll bear with me for a couple of moments. Let's just say, for example, you've got 50 adopted children. They come from different backgrounds, different countries. The fact is that each of these 50 children are using the rules of the allowance that you're giving to them in a different way. They've got different rules. In the same way, states have different Medicaid rules. The eligibility, the situations, the amounts. And from there, they give a partial bill back to the federal government. So you can see in particular states, for example, you'll see that if you go to skilled nursing facility care under Medicaid, right, that they can go after your assets. And now you have legal structures and all sorts of other types of mechanisms that attorneys try to erect in order to avoid this, prevent this for households. In certain states, that can be effective. In other states, it's not. And the reason for that is because the Medicaid rules are different from location to location. This, and in that, what ends up happening is the states who have weak Medicaid, right, end up saving themselves money, but the Medicaid system itself gets a bigger bill from those states with more lenient, more robust Medicaid benefits. So that's complicated to start. The second part of complication is, as those people affected would know, is that the error rates are high already, right? In other words, prior to a new administration, even, and it, again, the identity of the president has not mattered, right? It doesn't matter what the party was, that the state are overwhelmed with Medicaid administration. Very complicated, right? It's more complicated now, is what I would say. And for that, for everyday people, what I would say very, very clearly, right, which is that for those people who are on Medicaid, who have presumed you're on Medicaid, I absolutely, positively suggest that you keep on top of your Medicaid eligibility. That maybe can mean you need to sign on to your state portal to make sure that what you thought you had, you in fact have in place. Now, the important difference here is that Medicaid is not the same as Medicaid expansion, which is the unfortunate naming problem that we have in our world. Right? This is a tax credit by the IRS. This here, Medicaid, is administered by your state, not the IRS. The reason I say this is that I'm hearing that people are being dropped off, and they don't know until you know when, right? The worst possible moment, when they have to go to the doctor, they find out from their doctor's office that, in fact, yes, their Medicaid eligibility has changed. And the reason you want to know this is that if you are ejected from Medicaid, that is one of these windows that allows you to apply for the Affordable Care Act. And now all of this stuff here now does apply to you. But again, time matters. The windows matter. This is why, in other words, if 4 months pass by and you've been kicked off Medicaid 4 months ago, you've been ejected, disqualified from Medicaid 4 months ago, and then you come to me and say, Jay, can I get into this? The answer is going to be no. Not until January. So as a result, the Inflation Reduction Act is the big unknown. The grants and subsidies of all sorts have been revoked, as you may have seen. And so now you can see what has happened here, right? Is that you may have believed that you are on a particular income level. Now this assumption has changed, for example. You may be able to get a bigger discount on your health insurance premium. So let's say, for example, you lost 50% of your income for your farm. You can see that your health insurance now, you can remember this used to be 500 odd, this is now down to 0. That is entirely possible. If you understood that this was tax credit to start. And now, since that's based on your income, and your income has dropped as a result of whatever changes have existed due to DOGE or whatever other reason, which can also be from your corporate employer, that in fact that you may be eligible for larger tax credits. I highly encourage that people examine this stuff. Medicaid next. So this is, like I said, if we go jump back here, and you can see the conundrum here, which is that yes, do I think that you're going to have lower, and you can see Larry Levitt putting it here, to which I'd probably agree, which is that let's just see here. When you erect barriers to Medicaid like premiums, or you end up rationing coverage by complexity and ability to pay. And so this basically is what I'm saying, right? It is already complicated. There are already errors to start. Promising to be, in the most likely situation, more complicated. More complicated. And you can see, and for people who are on X, I definitely suggest Larry Levitt as a follow, because he does generally give you, and you can see here swatting away certain other hot takes for in policies, right? Which is some people might think, okay, our immigration problem is they're receiving, the Affordable Care Act, or they're getting Medicare, et cetera, Medicaid. No, you don't. Part of the qualification and eligibility is you must be a documented immigrant. For example, under Medicare, crazy people write books about Medicare. You need to have a valid residential status for 5 continuous years. So you have to be documented, and you have to have a document, a government document. So any hot take you see out there says undocumented immigrants are there getting these federal benefits to which they're not entitled. That's just simply not the case. That is simply not the case. And you can see it here. Medicaid does not reimburse hospitals for emergency care provided to undocumented immigrants. So while that doesn't mean that the hospital doesn't have a problem, right? They will. The point is, it's not going to be paid for via Medicaid, which has existed in to be candid with you, in every administration, right? And you can see it here. Some states use their own money. That's on the state. That is not at the federal level. Very complicated, but it's also important to understand the differences, the nuances here, right? Because what ends up happening is everyone just wants to throw a rock without discrimination, right? And it's like, okay, well, just like, it's their fault. It's not. This is not the federal government here. For financial planning purposes, let's just say you're white collar. You've lost or a farmer, for example, with 50 acres is not a poor person, right? They may not feel wealthy. They are factually not poor. The issue is that now what this has done is this has, for me, right? My professional opinion here is now your strategy about tax efficiency, savings, and investment is more important rather than less. What's taxable? What isn't? Right? The effect on your entire family, household financial plan, your setup can be notably changed. And you can understand then what I actually do to keep the lights on here, which is I'm helping those households work through these timelines across all of their assets and their expenses, thinking through their investment strategy, not issue selection. Today's not financial advice, which is to then, okay, how do we keep the lights on? How do we make the situation less unsettling? I didn't say unsettling, right? Being suddenly unemployed is unsettling by its nature. That said, how do we manage today and for the years to come? And now we've got a moving target here, right? Because of these, we do have a moving target. There's no question, which is that we need to understand that, okay, well, the rules can change. We need to be flexible, and the ripple effects are going to be all the way down over to here. And that's my point, which is that now the arrangement and knowing what's in these buckets, what's in these rows here, now has become more important not less, a lot more important, because of the fact that you can see these big differences just here on this line item. This is a $6,000 a year of cash that could be obviously used for groceries and your cable bill or your homeowner's insurance bill, which is now higher. So these are the practical realities here about what's going on. We're just going to continue on. We don't have that much more time. I won't use too much more time out of respect for that time and the rest of your weekend. Here we go to Medicare. So under Medicare, I don't expect base Part A, Part B in the funding. I don't expect like huge funding declines. And the political reality is the AARP usually wins. That there are very few political debates in this country where the AARP, the baby boomers, don't win. Now, there's also a reason for hashtag #OKBoomer, which is if I were Gen Z, millennial, and I had lots of money, I would definitely band together and say, okay, we're getting run over here. That's a fact. That's very true. Very true. All of these rules, Secure Act, etc., what they're doing is they're pushing out tax receipts when we've got interest costs now, today, which are weakening our federal finances. Fact. And every rule change that we see favors who? The AARP. And I'm using AARP not as the organization, but of the generation. Immediately under fire will very likely very similar to the APTC under the Affordable Care Act, which is the Advanced Premium Tax Credit. I do think that Part D will be under fire. Now, today, right? Do I think that drug negotiation's safe? Probably safe. Probably safe. And the simple reason is too popular across the aisles. The Inflation Reduction Act, however, is probably not safe. And the issue here is if we just did a broad stroke and said all of the provisions of the Inflation Reduction Act are, the collateral damage here is down here, the $2,000 a year cap. This was the outstanding, and I've made lots of notes of it here and appeared in the media very many times, highlighting that this is the real winner here for Medicare beneficiaries, which is there's a $2,000 out-of-pocket cap for prescription drug benefits. So you can see, and I should have ordered this differently, which is since this is the winner, what ends up happening is that month to month today, this seems anecdotally to be violated, and I'm not quite sure how. I'm sure the answer it is, which is there was supposed to be a $35 cap, $30 cap. So I'm very sure that deep in the weeds, and you should call, and I'm going to give you the pro tip, which is down here, which is I would keep on top of your accounting carefully on Part D. Very, very carefully. That since we've got this political crossfire, since we have DOGE on, and since the upside to the Inflation Reduction Act here are these, since that's the case, I would simply call the pharmacy before refilling. Because if you get a number you don't expect, I would call a different pharmacy, to be candid with you, because all Part D plans, as well as Medicare Advantage prescription drug plans, they're going to have multiple preferred pharmacies. I've told people, look, yes, it's accepted at, let's just call it the big national pharmacies. That doesn't mean that the price is the same from Walgreens. I'm just making it up. Walgreens versus CVS. No, that is not the case. It is not the case that the most efficient price is at Walgreens and not at CVS, even if both are preferred with your Part D plan or underneath your Medicare Advantage prescription drug plan. And when I see these things moving around in ways that we don't expect, my point here to people is that if you have medications, anything expensive whatsoever, check the price before refilling. I don't like when people get negative surprises at the counter. Feels like 10 times worse. I think you know this, right? So today is a unique session here. I'm going to use the last third. Is, the reason I don't point out lots of things on TikTok or in social media and stuff like this is I see lots of, B word and moaning, right? About, fair and shouldn't work this way, or this is how it's supposed to be, or international, our health system stinks compared to some other health system in some country, 3,000 miles away. It should work like them. I reject all of it. And the simple reason is that the way that we are taxed, the way that it costs people to be educated to be healthcare providers in this country, in every healthcare provider, from nurse to physician and every spot in between, is radically different in the United States compared to other countries. Tax, cost of education. So before you come to me and say, oh, well, in Italy, blah, 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 we only play some, some small amount, et cetera, and we get, our healthcare for healthcare expenses are zero because healthcare is free and stuff like that. Yeah, well, you didn't consider the fact that there could be a tax. And in certain countries in Europe, for example, that tax is way over 10% for healthcare alone. Call up your senator and propose that to them. See how far that gets you. That's what I would have said every year until this year. Because the fact is that if we accept tariffs, everything changes. So let me first take a moment on tariffs. Okay. Tariffs are a tax. Period. Tariffs are a regressive tax. And by regressive, what I mean is very clearly, if the cost of onions goes up by 25%, the person who lives check to check is hurt worse. The millionaire he or she doesn't like it. I didn't say that. But the factual matter is the person who is financially struggling is hurt disproportionately more. That's the definition of regressive. Okay? And this happens in other countries because they have something called value added tax, VAT. GST in other countries, goods and services tax. Tariff is the US version, which seems to not be getting discarded out of hand. The macroeconomics 301 class on the macroeconomic and timing of tariffs, it's a rationale of tariffs, will wait for another day. But the reality is, if we can accept extra tax, we have a way to plug lots of holes. On top of that, we can do the following. You will see in the coming days something like this. I strongly suspect something like this. That Medicaid can be per person per diem. Right? The idea of eliminating Medicaid entirely is a non-starter, right? That will not occur politically. But what we could do is, you can remember I described Medicaid as these 50 children running around, picking off the federal government with their state-specific rules. That stops cold if you just have a per person per diem, adjusted for cost of living differences. Right? It costs more in some location than others to live. Understood. And then there's an emergency fund just in case at federal level. And what I mean by this is the pushback to this block, and this is block grant. This is block grant. And don't get me wrong, this is not a popular proposal, right? The people who are, staunch Medicaid advocates will not like me saying this, but this is possible. Which is, since we are here, and if DOGE happened to call me, which is the thumbnail, right? If DOGE called me, this is what I would start with on Medicaid. And it's not because I'm trying to kick people off Medicaid. It's because I'm trying to not have this. I don't want to have different rules for different locations on something where the federal government is being the one being picked off. So you could make it more efficient simply by per person per diem. And what ends up happening is some people say, okay, well, we've got a public health crisis in a particular location. Okay, that's why the federal level would have the funds in its pocket. In other words, you could call up Medicaid and get the extra money. Now, that's going to have, controversy attached to it. Oh, the federal government's too unresponsive, et cetera, et cetera. And there are going to be elements of truth to all that. I didn't say there's not going to be a solution without here, right? It's impossible. It's too complicated. The underlying situation is complicated. Therefore, the solution is going to be controversial. Has to be. But the reality is right now, what we have so much of this that we are not quite sure where this excess money is going and how much it actually is overpaying, underpaying, because in state number 1, you've got a very robust Medicaid eligibility and benefits package that does not exist in state number 39. And no way for the federal government to basically equate state 1 to state 39 and put them on equal footing. The only way to do that for me is per diem. And that is otherwise known as, well, I've called it block grant. Right? Block grant. There we go. Sorry, Mr. Bluke. Okay? For ACA, here's the one. And this is going to be somewhat complicated, but basically this is, we need Wall Street's help. We need Wall Street's help. So what you do not know necessarily for those people, and I don't like the pigeonholing, right? And here, and I'm going to go to the side again here. Right, what I don't know about the pigeonholing and the reason that, YouTube and a lot of my efforts go without an audience, anywhere near to its usefulness, is because of the fact that the YouTube watches my videos and say, okay, what's this guy talking about? He's talking about health insurance. Is that really true? Not really. Would they know anything about the fact that I have been bond derivatives trader around the planet with the world's largest investors? No. And so what ends up happening is that they pigeonhole videos and information, right? This is the problem with social media. One of the many problems, besides the blatant untruth, the truth is the fact that YouTube and the algos are there to put you in a niche and keep you in the niche. That's fine until the topics interact. And here we are. Which is affordable care. Let's just say you're carrier number 5 and you sold a bunch of ACA plans. You sell them to Wall Street. And in addition, so what they will do is they will package them together and sell them to the bond market. Now, this happens already, right? This happens with your credit card loans. This happens with your mortgages. So the idea, though, this has never been done before. No, this is just porting that technology. The difference here, the nuance here is since we are doing this and making this by block grant, we are saving money to which that Medicaid is the owner of the riskiest tranche of these packaged ACA bonds. This is fairly complicated, right? Which is that if you want to understand the housing crisis, basically, it is not the fact that there are these defaults. The problem because the structures of the bonds may have been totally okay. The problem is the riskiest tranches were owned by banks, the Lehman Brothers of the world. And since those lost, now you start losing at that level. Now, under here, that can happen except for Medicaid is the one absorbing the loss, which, by the way, is no different than today, right? If you've lost all your financial savings and you don't even have money to pay bills, Medicaid and SSI, they're going to provide assistance. Well, that happens now. If you have Medicaid as the backstop, now all sorts of other things, it's like a key to unlock the door, right? So in other words, what happens is since this already happens, Medicaid becomes the owner of the riskiest securities, and now reinsurance companies can now start adding extra layers of protection. Protecting who? The bond owners. Right? The reality of this, if you're lost over the last 3 minutes, 5 minutes, this exists already. If you look at your bond fund prospectus, for example, or if you own Global Bond Fund or US, the Lehman Ag or BND, the EFT, they'll have something called asset-backed securities in there, mortgage-backed securities, Fannie Mae, Freddie Mac, well-known names, right? Where what ends up happening is Wall Street takes a bunch of Freddie Mac bonds and packages them together and slices and dices. And someone owns risky stuff and someone owns not risky stuff. What I'm proposing here is Medicaid is the systematic owner of the riskiest. And now all of a sudden, since it's the backstop, now we can have other layers of insurance here. And now what this will do, and don't worry about this, as far as this mechanics, dangle this in front of Goldman and Morgan Stanley. They're on the case by Tuesday. No problem. Okay, that is not the issue. The issue is that insurance companies won't like this a bit. And now the reason that they won't like this is that the money in insurance is the fact that they are selling you, all of financial companies are selling you tail risk. They are the sell. You have to understand, and now we're a little bit more complicated, that insurance companies and are rightfully, I didn't say wrongfully, they are rightfully the sellers of way out here or way down here. Right? And if that doesn't come to pass, they keep the premium. The issue, what I am proposing here, what I am suggesting here, if DOGE called me, I would say, look, the world is overpaying for this, of which there's no other buyer, right? Meaning that Mr. and Mrs. Smith, they have no choice. They've got to buy, right? They don't want to go bankrupt. The downside is too negative, so they overpay for this tail risk down here. Well, guess what? Now all of a sudden, Medicaid's the owner. Meaning that Mr. and Smith then are paying for the middle, which will be lower. And oh yeah, by the way, the bond market and Wall Street will find the price. They'll find the price, I promise. Absolutely. They will find the efficient price. The market clearing price. The insurance companies won't like this. And the reason they won't like it is because the extra money is in managing, right, the differences, the stuff underneath this blue bar. Network, copay, co-insurance, all the minutia over there. I can't solve that. I promise you that I can't. I promise you that lots of effort has been made and it's failed. You can remember years ago, JP Morgan, Berkshire, who else was it? JP Morgan, Berkshire, Google, or Facebook, one of the two. JP Morgan, Google, and I want to call it Google. That they tried to have this 3-company consortium where everyone could go under the health insurance plan just among those 3 companies, which are enormous. They failed. It failed. Why? Because they couldn't get the attachment points on which to get the coverage and answer what goes on underneath the blue curve. Under this situation, you take care of that because Medicaid is paying the tail, and now you just let the insurance companies do it. That's totally fine since you can't solve it. But what have you done? We've jammed down the price. Why is that? Because the bond market and Wall Street have found the price for you. Who will not like this? The insurance companies. That's where the money is. Right? In the sludge is where the profits are. And this combination takes that away. In the similar way, Medicare. Lots of noise. Lots and lots of noise. Right? You'll see it here. UnitedHealthcare falls on report DOJ is probing its Medicare billing practices. This has to do with Medicare Advantage. There's nothing to do with Luigi Mangione, the vigilante murderer who thought that he was going to change the world by killing the CEO. It's like insane. This is not new under Medicare. Let me first say that one way would be to have Part A and Part B have an out-of-pocket maximum. Probably doesn't work. Even it's not the price, by the way. It's not the 3% that it would cost. That's an estimate, right? A studied estimate. But it's a question of Is it Part A or Part B pay? And the reason for that is that these are two separate line items in the federal budget. Okay, so we can't, I can resolve this 3%. I can't resolve this one. So I have found, and again, DOGE isn't calling me, no one from the federal government is calling me, is that what happens is that when Medicare Advantage plans get made, the federal government hands a price. Let's just call it 500. It's not 500. Let's just call it 800. So this is $800 a month. So it's like you've given your 5 children an allowance, not the 50 children now, because that was state by state. You've got 5 children at home. You give them 800. You give them $100 a month. They spend 80. They keep 20. The issue is why? Would you volunteer and just say, okay, I'm going to give everyone $100 a month? You would never do that. What would you rather do? You would rather say, okay, show me your bills, right? I'm going to let you keep some, but I don't want you just to be, us be giving you the information and then you just doing what you want and then telling me later. Because in addition to that, there's an emergency fund, right? So in other words, child number one, oh, well, then also, he spent the $80. Now he spent $100 and he said, oh, I have an emergency, so I need more 25 extra dollars, and they get it. And this is the risk adjustment. And that's the point of this. That it's not only the $100, but they get an extra $25 for the people who are more sick. So the issue that I'm proposing is to flip this on its head, which is simply that, and simply it's not that simple, right? Which is to let the insurance company bid. Right? Okay. Again, we are not going to resolve network and all of the other complications here underneath this curve. There are too many attachment points. Right? You would have to entirely change. We'd have to go to an entirely different setup for healthcare. And not only that, the education, the taxation, all of it would have to rip down from the struts. We don't have the political capital to do so. It's not even clear that these guys are going to be able to change the Affordable Care Act in a way to affect the Inflation Reduction Act. That's not even clear. So the idea that we're going to be able to overhaul all into this entirely is not clear, except we can do this, which is we let the companies tell us, okay, what's the bid? In this situation, it's 80 plus anticipated 25. Right now, we're just giving them 100, and we're giving them an extra 25 if they've got a cancer patient. Right? That's the point of, that's the risk adjustment. This is the health reimbursement, which is the upcoding. You can look that up on Google. And that's the source of the controversy here. So instead, we let the insurance companies bid without a risk adjustment. We don't get the child to come to us after with the sob story and say, okay, well, the dog ate my notebook and now I need 5 new notebooks. We don't. That person here has all the information. They've got it today. right? In other words, they've got the data underneath this curve of the population, right? Was it 66 million, 67, 68 million on Medicare today? They've got enough data. This would solve then what? That would solve the inefficiency problem. This solves the upcoding problem immediately, right? The insurance companies are doing the bidding, not just me volunteering $100 a month to my 5 children. We're not. And by the way, if the companies are not competitive, you don't get to offer at all for the next year. Right? In other words, what this does is flips it on its head and just requires the insurance companies to do the bidding. And if they do the bidding, and if carrier number 7 says, oh, well, we're going to just, we'll just offer it at $500 a month. That's their bid. Well, they're too far off the market. They don't get to offer to anyone. The negative to this, of course, then is that carrier who is now non-competitive is not going to exist, in which case that people will need to change plans, in which case there's going to be other technical issues under Medicare. Nevertheless, this is the path. This is a possible path that the CMS could enact. This is doable. Last point here is under prescription drugs. And I've stated this before I changed it to Jay's Corner, it was called the Maximize Your Medicare newsletter. I've been pleading for Amazon to please arrive as a pharmaceutical. Not to, kill off every pharmacy, but it's just simply economics to just get the most efficient price. Another path is to have something called most favored nations, which is a commercial term that is used, and in bond market world, this is called pari passu. In other words, the technology exists. In other words, no favorable side deals to anyone. That since this is so complicated underneath here, and now the underneath here is, the systematic cost of health and healthcare on an overall basis, since it's so complicated, that you simply just say no side deals. And the way it simply works is if you offer medication 1 at XXX to one party, that's the price everyone gets. None of this is possible even a couple of months. Well, let me just say that these have been possible, right? What I've said here have been possible under prior regimes. And by regime, I just mean under prior administrations. Right? We have a democratic society, that we didn't have the political will for shock. So you don't hear me saying that DOGE is a bad idea just from the ground up. I didn't say that. In other words, I don't have a problem with the idea that the government needs to be more efficient. Now, there are ripple effects to it, and again, beyond today, right? That's macroeconomics 301. The question is, okay, well, government consumes. Who's going to replace government consumption? That's open-ended. And we won't resolve it today. That said, you can see here, these are practical steps that if the window has opened for tariffs, the window has opened for the idea that we can have regressive tax, then the idea in principle is that we can then make other changes to other aspects of very, very significant portions of federal government spending. Okay, that's it for today. jo.substack.com. Be sure to You can find out other things about me. This is my private website, jo.com, right, which is not the newsletter, but more about me and my work. If you want to look up my name online and look in all the different locations that my quotes are in the national media, no problem. Hopefully you've liked today. Please hit the like button. Please subscribe to the channel and tell someone else. Thanks, everyone. Have a good Sunday.